Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, an important study was published in the American Journal of Clinical Nutrition in August of 2018. Now, the findings combine data from two long-running studies. The Health Professionals Follow-Up Study, whereby researchers have followed the dietary patterns and health parameters of over 46,000 male health practitioners in the United States from the year 1986 to the year 2012. And the Nurses' Health Study, which has followed the dietary and health parameters of over 74,000 registered female nurses in the United States from 1984 to the year 2012. Now, the diet of each of the more than 120,000 health practitioners were assessed every 4 years during the 26-year follow-up period. It's an extensive study. Now, in this portion of the study, researchers assessed the glycemic nature of the individual diets, which means looking at the extent to which the diet would elicit a high blood sugar response and a high insulin secretion response, something that researchers call the Empirical Dietary Index for Hyperinsulinemia, or the EDIH. So they then correlated the glycemic potential of each person's diet with risk of colorectal cancer. Now, the results showed that for men, those with the highest glycemic diets had a 33% increased risk of developing colon cancer compared to men adhering to the lowest glycemic dietary pattern. Now, for women consuming the highest glycemic diets had a 22% increased risk of colon cancer compared to women who followed the lowest glycemic dietary pattern. Now, this is important because previous studies have shown that very sugary and starchy diets that are high glycemic, that promote high blood sugar and increase the release of insulin, as well as high insulin states such as prediabetes, type 2 diabetes, and insulin-dependent diabetes, these are all associated with increased risk of colorectal cancer in many studies. A high level of insulin promotes rapid cell division of cells that line the colon and the rectum. So the cells are dividing faster when there's a lot of insulin in the circulation. This in turn results in a greater risk that genetic mutations will occur during those cell divisions, and some of those mutations can produce cancerous changes resulting in colorectal cancer. That's how we think a high sugary or super starchy diet and these high insulin states contribute to colorectal cancer. So the researchers conclude the findings of this study suggest that the insulinemic potential of the diet may partly underlie the influence of dietary intake on colorectal cancer development. Now, over the years, studies have shown that approximately 70 to 90% of colon cancer cases can be prevented through more prudent dietary and lifestyle factors. So keeping your blood sugar level below 5.0, or more ideally below 4.7 millimoles per liter, is one way to help reduce risk of colorectal cancer, possibly by 26% when combining data from men and women. Now, other ways to reduce risk of colorectal cancer that we've seen in other studies include this: reducing or eliminating intake of high-fat animal products, with the exception of fish, and also reducing the intake of deep-fried foods, breaded foods, creamy salad dressings, foods that are loaded with trans fats, and consuming at least 1,000 milligrams a day of calcium from food and/or supplements, maintaining a blood vitamin D level that's above 75 nanomoles per liter, ensuring that you consume at least 400 micrograms a day of the B vitamin folic acid, reducing or eliminating your intake of alcohol, reducing or avoiding altogether the intake of smoked meats, charred meats, barbecued meats, and meats that are cooked to very high temperatures, avoiding foods preserved with nitrates and nitrites, remaining at your ideal body weight, engaging in regular physical activity, and not smoking. All these nutrition and lifestyle strategies have been shown to help reduce risk of colorectal cancer to varying degrees. When you combine all the strategies into a comprehensive wellness game plan, the risk of colon cancer and many other degenerative diseases like heart disease, Alzheimer's disease, and other forms of cancer can be markedly reduced. So I would encourage you to review the list of these strategies again, as together they pave the way to helping to optimize your healthy life expectancy, the number of years you're likely to have a highly functioning body and mind. Of course, having regular colonoscopies especially after the age of 50. To find and remove any polyps is also a vital prevention strategy in preventing colon cancer development. Remember that colorectal cancer is the second leading cause of cancer death in this part of the world when you combine statistics for men and women. So having a colorectal cancer prevention strategy is an important part of your overall wellness game plan. Now, I've included a link to the research studies cited here in the text below. Thanks for watching, and I'll see you next time.